have requested our Director of Health Services, MCH, to investigate into this case, to look into all the details. But prima facie, the case is like this. In the month of January, that is January this year, the person in question, had come at a very critical situation to Jengjal Hospital from North Gaurav district. And when she came, thankfully, the subdivision hospital has very expert gynecologist pediatrician there, unlike in many other places. They literally did a lot of work to save her life. In fact, the staff of the hospital had gone to the extent of donating blood to arrest her bleeding, and she was already bleeding, and she was to arrest the bleeding and all. They had done all this exercise. 4 months later, on different occasion, this matter had come up, and internally they had dealt between the party and the hospital and some expenses. But still, the matter is under investigation. I want to take all the documentation before we coming to it. But the point here is very important. Jengjal Sub Division Hospital is now very reputed. I request all of you to actually, if you're willing, we will also kind of come with you, but to arrange it, that they have created a lot of changes in that area in terms of, because they have a, in subdivision, as a subdivision hospital, they have a ICU there, they have a neonatal ICU, they have a PICU, they have an operation theatre, they have a gynecologist, they have a pediatrician, and it provides services to so many of them. And they have really helped a lot for the community that side. Many people even from very far distances come. I have myself seen patients, even some of them going from as far as West Kasi Hills to all the way there to take some specialized treatments. So that level has happened. But anyway, with all objectivity, without saying all these things and etc., we are still looking at the case individually and what exactly had happened case to case basis. Prima facie, I would like to remind you all that particular person in question's life was first saved by the same hospital, and after that, etc. And the condition what was found also, we want to ascertain what exactly had happened, because there is some version of hospital and some version of the patient is saying. So give us some time, we'll come into that. But again, in that case also, as the notification was issued from the department, the process of investigation is on. Before that, naming people and putting them, they all have, all the doctors, senior doctors are here, they have very long career, and it is very, very, very close to them, like all of yours and ours also, etc. It's very close to them. So I request all of you to not, none of you to in fact take any names or etc. like that until a proper inquiry is done, and whatever further course of action will be done based on the inquiry.